Hello and welcome to PHM 6110. Today we'll be looking at healthcare access and ethics for vulnerable population. And to do so, we'll be doing we've kind of focusing in a number of learning objectives. The first, which is to discuss vulnerability framework, also look at a couple of population groups that will be classified as a vulnerable population. And then secondly, by the end of this class, you will be able to analyze the characteristics and health concerns of two specific vulnerable population, which is the homeless population and migrant workers. And then lastly, you will be able to analyze the role of healthcare policies and practice and how it is related to addressing or perpetuating inequities in access to care across different subpopulations. So, starting with the first learning objective, where we're going to focus a lot on vulnerability framework. So, let's start by identifying or defining what vulnerability is. It's in very, very simple terms. It means being at a greater risk of poor health outcomes or poor health in general due to a combination of factors that include social, economic, and personal factors. So, vulnerability as a concept happens when someone has more health risks and fewer resources to stay healthy. So you're looking at both sides of it. First, that your risk to illnesses or your risk to not having good well-being is greater, but also the fact that you also do not you also have fewer resources that could help you stay healthy. So people who are vulnerable or people who are in the vulnerable population often have harder time getting health care, or when they do receive health care, they also have the care that they receive is generally of a lower quality than other people. So, if when you're thinking about what makes a person vulnerable, or what are some of the key characteristics you should be looking at in determining whether vulnerability exists or not, we can look at it in terms of who is more likely to develop health problems, who is more likely to be affected by the health problems when they do have it, and lastly, who is less able to get help or support that they need as a result of having health problems. So you have to kind of look at these three characteristics when determining vulnerability. So that said, let's really go into the vulnerability framework. So what the vulnerability framework does is that it helps in explaining why some people, some populations are more likely to experience poorer health outcomes. So, and to do so, we look at it by a couple of elements. The first is one's personal characteristics, and then we also look at it in terms of the condition of the community in which they live and how that community or the conditions within that community interacts. That interacts in such a way that it influences their access to healthcare, the quality of health that the quality of health care that they receive, and also what their health outcomes is a result of these interactions. So there is a model that is used for the vulnerability framework, and it's very, very essential in population health management because it helps us professionals to identify those individuals or populations that are most at risk of having poor health outcomes. So each component of the vulnerability framework, which I will show you guys what that model looks like in a bit. So each component is interconnected, and the fact that of the this interconnectedness of these different components creates a pathways that link social determinants of health to both individual and population health outcomes. So you may have noticed that there's a lot of emphasis on social determinants of health in this course is to kind of help you in situating in your mind just how much social determinants of health plays a role in individual and population health outcomes. So, an example of this interconnectedness would be on the individual basis. We could look at a person who has asthma. So, this person already has asthma, right? They've been diagnosed with asthma, and then this person lives in a polluted city. So, for the fact that they have asthma and they live in a polluted city makes them more vulnerable to having respiratory problems, respiratory problems in this case, and breathing problems, because both their health conditions and their environment have increased their risk of having respiratory problems. On a population health level or on an ecological health level, an example of this interconnectedness would be a low income urban neighborhood that has limited access to healthcare services. For the fact that residents live within this neighborhood increases their risk of things like chronic conditions, and the fact that they have chronic conditions, for those who have chronic conditions live in that neighborhood, it exacerbates their vulnerability. So this is what the vulnerability framework looks like. On the hand right side, on the left hand side, my left hand side, which I hope is your left hand side. On the left hand side, we have the ecological element where we are looking at predisposing, enabling, and needs factors. We're going to discuss it. We also have the individual, where we have predisposing, enabling, and needs factors. So in this framework, it shows that ecological is feeding into the individual elements. In reality, they are both feeding into each other, in the sense that ecological elements impacts the physical element. Sorry, ecological elements impacts the individual elements, and individual elements impacts the ecological elements. And then in the middle, we have vulnerability being seen as both, the ecological and the individual elements. Their interconnectedness is what creates this vulnerability, which then feeds into access to care, quality of care, which then, feeds into the health outcome, both on the individual and on a population health level. So we're going to start discussing the vulnerability framework, and we're going to start with ecological and individual elements of it. So on the ecological elements or ecological factors, we're kind of looking at it in terms of community level conditions that influence population health. And this is, where you have some of the social determinants of health, like socioeconomic status, but you also have things like infrastructure, healthcare infrastructure, and environmental determinants of health. On the individual elements or individual factors, we're kind of looking at one's personal characteristics and circumstances that shape their individual health risk and the needs that they have in terms of healthcare. That we will have age, genetic predispositions, things like whether you have a family history of a particular disorder, and your behavioral choices. So both categories, that is the ecological and the individual factors, are interconnected, like I said before. And for both of them, they are classified into three components, where we have predisposing, enabling, and needs factors. So vulnerability arises when the ecological and the individual elements compound each other, and thereby increasing the health risk, and also increasing the barriers to healthcare services. So starting with the predisposing factors, these are in a way to kind of understand what they are. They are those characteristics that increases our likelihood, or a person's likelihood, of experiencing health problems, whether or not you have it at the start of looking at it, or whether you are at a potential risk of having it in the future. So we are not just looking at characteristics in terms of whether this person has these health problems. We are also looking at it in terms of, is this person at risk of having these health problems? What are all of those predisposing factors that could increase a person's risk of having those health problems? So, on the ecological side, we have things like high poverty rates, environmental pollutions that increases population health levels of respiratory or cardiovascular diseases. You also have things like social stigma around mental health, how it discourages help seeking behavior. I'm going to give an example of this in terms of having or not, or where you don't have that. So, an example would be, let's use, for example, you live in a community where there is a lot of allostatic load as a result of negative interaction with the police, or negative interaction with enforcement. Just as a result of living in that community, you are at an increased risk of having or developing a mental health disorder. Or if you already have the mental health disorder, you are at a increased vulnerability of it getting worse. Now, cultural stigma comes into place in the sense that because you live in that environment, which you already have that risk of allostatic load that comes from negative interaction with law enforcement, but the cultural stigma makes it harder for you to seek help in terms of either getting help to prevent those mental health conditions from coming on, or if it does come on, preventing from getting a bit more less manageable for you. So this is how you kind of look at it in terms of predisposing factors. So on the individual predisposing factors, we have something like age. Just the fact of being older makes you more prone to vulnerable population, while on the other hand, just for the fact that you are an infant or you're very young, makes you more vulnerable to infectious diseases. Race, it kind of plays a very unique role in the sense that it is both an individual predisposing factor as well as an ecological predisposing factor, in the sense that systemic racism has made it in such a way that people of minority racial and ethnic group tend to live in the same place. And for the fact that they live in this same place increases the likelihood of having less resources. So it is both an individual predisposing factor as well as playing a role as an ecological predisposing factor. Genetic predisposing factors, things like having family history of hypertension or diabetes, for instance, or cancers. They increase your risk of that you might develop those disorders in the future if you don't already have it. Then, with the enabling factors, these are resources that support or restrict one's ability to maintain good health, or having access to having access to healthcare services, in the sense of there is, as a result of these resources, having these resources makes it easy for you to have access to healthcare services and also to have good health. So on the ecological side, we're looking at whether healthcare services are even available, or whether there is public transportations, or whether that community offers social services, or even if there are social services available. And then things like affordable housing and food security are one of those enabling factors that promotes health outcomes. If there's no affordable housing, you're more likely to have poor health. If you're not having access to healthy food, you're more likely to develop diabetes or having obesity. So that's what I mean. So community-based programs also are ecological factors, because if there are community-based programs, then you may have access to things like free screening and more preventive care or like when you have to rely on, let's use, for example, emergency services in order to get good healthcare service. On the individual level, we can look at income as being an enabling factor whereby people who have a higher income are more able to afford healthcare services. Income also plays a role in terms of health insurance. If you have a good job, usually a good job is also paying you very well. You're also more likely to have a very good coverage in terms of health insurance. If you don't have a good income, or if you're employed on a part-time basis, your likelihood of getting health insurance is lower, which means you're going to have to pay out of pocket for most of your health services, which increases your risk of not being able to afford these healthcare services. Having social support is another thing that is an enabling factor. An example that I would give in terms of explaining how social support helps: if you have a friend that you can borrow $2,000, it is huge. If, let's just for example, your car breaks down and you had to fix the car and you had to also pay the rent, and you don't have enough money to support paying both rent and fixing the car, the fact that you can have someone that you can call and say, can you, lend me this amount of money, or can I charge fixing my car on your credit card and I'm going to pay you over time? That is very, very huge. Not just because it removes that stress of not knowing whether you're going to be able to fix your car as well as pay rent, but also the fact that you kind of have a little bit of ease in the sense of not having to worry that I don't know what to do. I have all of these bills to pay. I don't know where to get the money. So this is where social support comes in, and also for those people who have young children, just to be able to have someone that could take your child just for a day, versus having to pay, like let's just for example, $500 just to have someone take care of your child because you're away and you have to urgently do something. So social support plays a very big role when it comes to emotional well-being and one's mental health management. So enabling factors, enhancing it, expanding it, is very, very important in when we're trying to look at things like how are we going to improve healthcare access and how do we reduce disparities. And finally, talking about the needs factors, these are health conditions or functional limitations that generate a need for health for medical services or social support. So examples on the ecological side is things like having high prevalence of chronic conditions, having limited availability of preventive care, thereby leading to increased demand for emergency services, and then environmental hazards like polluted air, contaminated water that creates a need for higher healthcare need. And on the personal, individual side or personal side, the fact that you have chronic illnesses such as cancer and asthma will increase your need for healthcare services just for the fact that you have this diseases. And also if you have a mental health disorder, if you're struggling with your mental health, you're going to have an increased need for medical services and also an increased need for social support. Also, physical disability is something that requires not, for some rehabilitation, and for some you may need assistive devices for the rest of your life. This increases your healthcare costs and your interaction with the healthcare system. So it's very, very important to identify and address ecological needs ecological and individual needs, in terms of looking at it in, what resources that needs to be allocated effectively, and how do you improve outcomes for both individual but as a population as well. So a quick reminder of the vulnerability framework. So we have talked about the ecological and individual elements of it and how that plays a role into one's vulnerability. Now let's talk about how vulnerability fits into access to care, or how it fits into quality of care. So, how does vulnerability affect access and quality? So, access to care refers to one's ability to obtain healthcare services that is timely but also appropriate. So vulnerable populations face greater barriers to receiving healthcare, which limits their access. And this, include, those barriers include finance, not, the fact that especially in the US, because a lot of payments is either have to be covered by insurance, or even when they're not covered by insurance, they are significantly more expensive than in other places. So that creates a financial barrier. First, the fact that health health care costs a lot in the US, but also if you don't have health insurance, there's very limited social buffer for you, and also having very high out of pocket expenses. You also have geographical barriers such as long distances. This is much common in rural areas, but also is also very common in areas where a lot of very poor people live. And I say this all the time, and I'm going to keep saying it. One of the things that shocked me the most about living in Hammond was the lack of public transportation. That was one of the I did not. I mean, I've lived here for 4 years, and I'm still not used to the fact that there is a town this big that does not have public transportation. This creates a lot of barriers for those who can't afford to have cars, or who cannot afford to have cars that you are relatively sure will be running at any time that you need it. So this becomes a geographical barrier. Language and cultural barriers is also something I talked about it in earlier modules. I talked about how I gave an example of how in Nigeria, people say I am well, even though what they really mean is I am not, definitely not well. For someone who is very, very unfamiliar with such, with that culture, both the patient and the provider is going to have a harder time communicating with each other, because even though they are both speaking English, they're not really saying the same thing. So this is where language and cultural barriers come in. So even when you are speaking the same language, you may not be saying the same thing. And of course, imagine where a person's English is a second language and is very, very different, or even a person who just doesn't speak English, living in a place where English is predominantly spoken, and there's not a lot of um, uh, accommodations made for those who do not speak English. So, structural barriers will include systemic racism, discriminations, and healthcare providers having implicit biases, or having retaining some prejudicial views about people of different races, or even people of different cultures. Example of how vulnerabilities affect access, or it would be an immigrant population may delay seeking healthcare even if it's available, due to feeling having concerns of maybe they will not be able to communicate well with the healthcare providers, or just the fear that they would be discriminated against. Now, this is not just the fact that they have been discriminated against, or they have experienced language barriers, just them having the perception that that language could be a barrier, or just the fact that they are afraid of being discriminated against, is a would increases their vulnerability, because just the fact that they have that perception uh, makes it likely that they may wait too long to seek health when they need it, therefore having to live with untreated health conditions. So that's why it's very important to expand healthcare services to underserved areas. Telehealth is one of those options that works very well in terms of reaching people, particularly as it has to do with financial barriers and geographical barriers, because a lot of the times people just look at financial barriers in terms of how much you're paying, like the cost of healthcare. But if you have to take time off work to go to hospital, and within that time you're not being paid for it, you are losing money, and that becomes a financial barrier to you. Also, if you have to take a public transportation in a place where it's going to take you about 30 minutes to get there versus taking about 10 minutes to drive there, that becomes a financial barrier and a geographical barrier. So kind of look at it in terms in that sense. So, how vulnerability affects quality? Let me start by kind of defining what quality of care is. We look at it in terms of the effectiveness, safety, and patient-centeredness of healthcare services that are provided to individuals or to populations. So, vulnerable populations often receive lower quality of healthcare, and some of that comes as a result of healthcare providers having implicit or unconscious biases against people of that community or even individuals, which can lead to either um, um, conditions being misdiagnosed, or even when they are rightly diagnosed, they go untreated because the providers have some kind of unconscious barriers that make you think, oh, because this person is, I'm going to use for an example, oh, because this person is black, they're not going to need so much painkillers. Oh, this, I think there's this thing about being a strong black woman that ends up affecting women when it comes to childbearing, because when they complain about pain, they are less likely to be taken seriously and less likely to be giving pain relief as a result of this misconception that Black women are strong and therefore do not need as much medical attention as, an example, white women. So there's also, this poor quality of health can come from limitations in healthcare services. If you live in an area where there's only one clinic for a large population of people, you're likely going to have a problem of being overcrowded, or rural communities may not be able to attract many healthcare providers, and they're likely to be, understaffed, therefore reducing the quality of care that these populations or these individuals receive. I've already talked about communication barriers, uh, but also in terms of how it affects low literacy, in the sense of, people with generally poorer education are most likely going to have poorer health literacy, which limits the way of understanding health treatments. So an example of how quality or how vulnerability affects quality of care would be, I mentioned this, but just kind of emphasize it, is that racial and minority individuals and populations, receive fewer diagnostic tests, and even when they are diagnosed, they receive, less effective treatment for chronic conditions. Not just chronic conditions, just typically many more conditions compared to white patients, which then leads to health disparities. So it's very important to train healthcare providers in cultural competence, which will help in reducing systemic biases and thereby increasing quality of care, and also thereby increasing health outcomes. So we have talked about the ecological and individual elements. We've also talked about how vulnerability affects access to care and quality of care. In this last piece, we're going to talk about how all of this, fits into individual and population level health outcomes. So, vulnerability leads to disparities in health outcomes. On the individual side, we're kind of looking at it in terms of poor management of chronic conditions that then lead to increased risk of complications and therefore increased risk of disability. Mental health, financial stress, discrimination, social anxiety, isolation, all of this increases one's risk of anxiety and depression. with social well-being, health problems reduces or limits one's employability, and for the fact that you have this poor social well-being also reduces your social engagement, which plays a part in having fewer social support, because maybe people will find you unpleasant because you have an undiagnosed mental health disorder or a poorly managed mental health disorder, which then leads into you having all of these challenges. From the population health perspective, we can look at it in terms of higher rates of preventable diseases,